How familiar are you with the relationship between gastric cancer and Helicobacter pylori or H. pylori? For those who may not know, there's a robust association between these two. H. pylori, a bacterium, has a notorious reputation for being a strong contributing factor to the development of gastric cancer. This relationship led to a systematic review and meta-analysis that examined whether eradication therapy could reduce the future incidence of this disease. The findings were promising, but they also revealed an unsettling fact. There was no reduction in gastric cancer-related mortality. This somewhat blurred the optimism derived from the initial results. But science as we know it is relentless. A lack of clarity simply means more work needs to be done. Therefore, an updated meta-analysis was conducted, gathering more data to better understand this complex relationship. The updated meta-analysis, with more data, gives us a clearer picture of the impact of eradication therapy. Let's delve deeper into the medical study. The researchers scoured the medical literature through February 2020, aiming to identify randomized controlled trials, or RCTs. They specifically sought out studies that examined the impact of eradication therapy on the future occurrence of gastric cancer in two groups. The first group consisted of healthy adults who tested positive for H. pylori, and the second group was made up of H. pylori positive patients with gastric neoplasia undergoing endoscopic mucosal resection. The researchers analyzed the data using several statistical measures. They calculated the relative risk, or RR, which is a measure of the strength of the association between exposure to a certain factor, in this case, H. pylori, and the outcome, which is gastric cancer. They also calculated the number needed to treat, or NNT, which tells us how many patients need to be treated to prevent one additional bad outcome. Lastly, they evaluated the disability-adjusted life years, or DALYs, gained from screening from the meta-analysis. This measure combines the years of life lost due to premature mortality and the years of life lost due to living in a state of less than full health. This study provides substantial evidence on the impact of eradication therapy. So, what did the study find? The research results indicate that eradication therapy substantially reduced the incidence of gastric cancer and the mortality from this disease in healthy individuals. This is a significant breakthrough, considering the substantial number of disability-adjusted life years that could be saved globally through population screening and treatment. Furthermore, the study found that eradication therapy reduced the incidence of future gastric cancer in patients already diagnosed with gastric neoplasia. This is a promising development, offering hope for patients already facing this health challenge. However, it's important to note that the reporting of adverse events was incomplete. This suggests there may be unknown factors that could influence the effectiveness of the eradication therapy. In conclusion, there is moderate evidence to suggest that Helicobacter pylori eradication therapy reduces the incidence of gastric cancer in healthy individuals and patients with gastric neoplasia in East Asian countries. There also appears to be a reduction in gastric cancer-related mortality.